The fourth article in the Go Wisdom magazine features Frances Waters and her colleagues' article, The STAR Theoretical Treatment of Youth with Complex Trauma. The STAR theoretical model is a comprehensive framework designed to guide therapists in treating children and adolescents with complex trauma and dissociation. We know that severe maltreatment and unpredictable care often forces children into a survival strategy. And then to map out the healing process, this model visualizes treatment as a 5-point star, with each point representing a foundational psychological or biological theory. And point one is attachment theory. When a child's caregiver is both a source of comfort and a source of terror, it will lead the child to what John Bowlby called a splitting of the ego. Different states emerging hold contradictory feelings. Some ego state will hold the states of craving for connection, while others will act as an angry protector or pseudo parents. And then point two of the STAR is dissociation theory. And dissociation is recognized as a vital defense mechanism. It allows a child to safely compartmentalize overwhelming pain and fear. So this to the abrupt shift of behavior when the trigger activating the defensive self strategy later in life. And then point three of the STAR is a child development theory, and it draws from Erik Erikson's psychosocial stages. Unresolved trauma can arrest a fragmented self-state at an early developmental stage, and then trap that part of the child in feeling of deep shame, distrust, and guilt. And the fourth point of the STAR integrates neurobiology. So, for example, a child's different self-state exhibited entire distinctive autonomic nervous system response. An aggressive protector might activating a sympathetic fight response, and a frightened inner child may collapse into a parasympathetic freeze. Finally, the fifth point of the STAR is the family system theory, specifically based on the work of Virginia Satir. And this point emphasizes that a child's system reflects a broader pain of dysfunction within their family, so treating a dissociative child in isolation is ineffective. The entire family system must be involved. So what are the implications for EMDR therapy? Because the child or the youth often lack a coherent autobiographical narrative and struggle with severe internal fragmentation, so standard EMDR protocol is just not enough. So during the preparation phases, EMDR must become highly experiential and play-based. Therapists can rely on the projective tools like stand tray, miniatures, puppets, and dissociative dolls to help the children map out their internal self states and understand their protective roles. And then also, establishing just one standard safe place is usually not enough. Because different self states might require their own unique safe space to feel secure. When it's time to come to the reprocessing phase, processing trauma, traumatic memory, clinician must act as a keen observer of the child's autonomic nervous system and tailor their intervention to each specific state's perception of safety. Processing relies heavily on sensory grounding, like dancing or moving, and play bilateral stimulation to keep the child within their window of tolerance. Ultimately, EMDR must turn parents into an active co-regulators. Parents are trained to manage their own emotional triggers and use sensory grounding, such as offering chewy candy or dropping a heavy object to break a dissociative trance, to forcefully orient their child triggering self back to the present day safety. So by uniting the entire family system, the child's fragmented states can safely heal and build a coherent, cohesive, integrative identity.